Hi, I'm Dr. Arlen Ford, the chairman and founder of Activator Methods International, and today I have a special guest here, Dr. Cindy Howard. Cindy has been through, I'd say, hell and back, and I'd like to talk to her, and she survived cancer. She's a cancer survivor, and we just thought it would be a good thing for her to help anybody that was dealing with cancer and that they may have learned something from her. So, good day to you, Dr. Howard.
Good day to you. And I have to tell you, I might have been to hell and back, but I made it fun on the journey. That's the difference.
That's the most important thing. Tell me a little bit about, how it started and where you've come from there. Just let's take it in sections, okay? How did it start and when did it start?
So a little over 10 years ago, I woke up one day with a giant lymph node sticking out of my neck. It was like the size of a golf ball. And I thought that was kind of weird. I don't feel sick. And I waited a couple days and I still didn't get sick. And I thought that was even weirder because usually, there's an illness that follows when the lymph node starts to pop. And, it was one of those things where I got a little nervous. And, sometimes when you're a doctor, you know too much. And, it's that, you go to school, you learn a few things, and then you have every disease that you learned about in your microbiology book, right? So it was one of those where I went, I wonder if I should overreact or if I should check this out. So I decided to check it out. And through a bunch of blood work and an x-ray and a CT scan and eventually a PET scan, I got to diagnose myself with Hodgkin's lymphoma, which is a little weird to, not sit across the table from a doctor, but to be the person who reads the test results and go, oh, shoot, I'm in big trouble here. So it was about 10 years ago that I discovered that and, made a pretty huge decision through a lot of questioning and research to go ahead and get some allopathic treatment, but really to co-treat myself on the natural side, because I knew that, in the world of medicine, sometimes they, as I like to joke, kill you while they keep you alive. And, there's a lot of bad stuff that they use to try to keep you alive. And I really wanted to clean up the mess that they created. So I incorporated really both avenues of medicine. And, little over 10 years later, I'm here to tell the story, which is great.
Tell me a little bit what you say about the other side. In other words, I think you're talking about functional medicine.
Well, actually, I'd say functional medicine is the good side, right? So, I
was referring
right.
to, yes.
Right. Yeah. So, the whole philosophy, right, in my world, in that world is anytime there's something wrong with you, right, a symptom, a disease, there's something underneath it that caused that, right? And we have to dig a little bit further to find that underlying cause. So, you can sit there and go, well, why did I get cancer? And I actually think I know why I experienced cancer. I can trace it back. I know a lot of choices that I made that weren't good and a lot of stress. And, I can paint that picture. But getting down to the root cause of why I think that I got there and what else wasn't working in my body well, and fixing that while going through the treatment, I think is what gets us through better, right? Because even if we attack cancer and we get rid of the cancer itself, if I don't fix the terrain that the cancer grew in the first place, what makes me think I won't wind up there again? And I think that's a really important point for everybody to realize, no matter what disease process you're walking through, is how bad was the terrain that you got there? And we need to clean that up.
Exactly. And what were some of the things how did you start cleaning it up?
Well, I went a little obsessive compulsive, you might say, because I have access to a lot of this stuff. So the first thing I did was run a bunch of tests. I looked for heavy metals. I ran gut function studies. I ran micronutrient tests to see if I was deficient in anything. I mean, I was looking for anything I could possibly find that could have been wrong in my body and started to supplement as such. But I also got really perfect with my food. And I'm going to take that back because I don't know how to teach anybody to be perfect with their food these days. My joke is if I tell you to be perfect, you're kind of dead because I got nothing left to give you. And I can rationalize almost anything out of somebody's diet, but I still cleaned it up where everything was organic or grass-fed or clean. And there was nothing processed, no sugar, nothing that had a chemical in it. And everything was grown on a tree or a vine or in the ground or slaughtered or fished for. Little graphic there, I guess. But just getting back to whole, good food where I was a good eater before I became a great eater. It was really important to make sure that I was feeding the body things that it could use and not things it had to figure out how to process through. So with good supplementation and good food, that really helped to support my environment better, A, to handle the treatment and then to recover and stay healthy, for this 10 plus years.
What was the treatment, the medical treatment?
Chemo. So actually, this is an interesting story. So when I was first, diagnosing myself, I made a very important phone call to a friend of mine, Dr. Michael Taylor, who practices out in Tulsa, Oklahoma. A very good friend, doctor of chiropractic, who I trust with my life. And I said, Mike, I've got everything covered. I'm going to go to Germany. I need you to connect me to Clinic St. George, which is a clinic in Germany. They're doing cancer very different than we do here in the United States. And he said to me, Cindy, you're not going to Germany. You're going to stay in this country. You're going to do chemotherapy and you're going to live. And I said, Mike, I'm not doing chemotherapy. It's poison. I don't want this stuff in my body. I'm, very opposed to this. I think there are better ways. And fortunately or unfortunately, Hodgkin's lymphoma, which is what I walked through, is 85% curable with chemotherapy. So I had to swallow my pride a little bit. And after, a lot of prayer, a lot of thought, and a little more homework, I thought, okay, he's probably right. So I wound up interviewing a couple different oncologists because the standard of care for chemotherapy is 4 different drugs, and the abbreviation is ABVD. And they're 4 different, very strong chemotherapy medications. And at the time I was diagnosed, there was a great clinical study to get rid of the B drug, which stands for bleomycin. Bleomycin is probably one of the most toxic. It causes heart problems and lung problems and, a lot of the side effects we get at the end. So they were running a study where they did it with the 3 drugs minus the bleomycin. And I said, okay, great, at least sign me up for that. And they said, you're not sick enough. And this is what's wrong with that world. Because I was diagnosed stage 2B and the trial was stage 3 or 4, they wouldn't let me into the trial. So I said, I'll tell you what, don't put me in the trial. Don't even put this through insurance. I'll just write the check. I don't want the bleomycin. And they wouldn't let me do it.
Wow.
Right? So even as a cash patient, I was told, you can't have that treatment. It's not standard of care. We refuse to do it. So unfortunately, I decided to go the ABVD route. And along with that, was doing high doses of IV vitamin C the day before, the day of, the day after. I was popping about 150 different pills to support my nutrients. And I went through the treatment. And 6 months later, I now have a couple lovely side effects from the bleomycin. It did cause lung damage. I'm at about 76% lung capacity. And I've got this lovely thing called Raynaud's that hinders me just a little bit. And I've learned how to control that. So I did wind up with some pretty good side effects. But, I guess as the joke goes, I'm alive to complain about the side effects. So, which is better than being dead and not complaining at all. So I took that. But there's some pretty harsh chemicals that you put in the body. And when you hear the word cure, sometimes you change your mind as to what your belief system was prior, because until you walk that walk, it's really hard to know what the right choice really is.
Exactly. So now, how long did it take you to come through the bad part?
6 months.
6 months.
6 months was the treatment.
Then it got better.
It got better. So, it's funny. So after at the 6-month mark, we did a full body PET scan, which is always really fun because they put you in a room and they, inject radioactive dye and then they walk out of the room because you're radioactive. So not very healthy. And you get the scan back and they say, congratulations, there's no more cancer. And on that visit, the oncologist says to me, okay, great. Now we're going to refer you to somebody for radiation. And I said, well, what are you radiating? And they said, well, the area where the tumors were, because it increases your chance by 5%. And I said, but if there's no tumor there, you're actually radiating healthy tissue. And I said to them, the sequela, when you read all the literature, is that 20 years later, you develop leukemia after you walk through lymphoma. And I said, you know why I think people get leukemia? I think because you radiate the crap out of them every 6 months for the next 5 years, and you damage the tissue that leads them down the path of leukemia. So I said, you know what? I'm going to take my chances for that extra 5%. Thank you. And I refused the radiation and, walked out of the facility and never turned around. And I had a really good fight with the oncologist because I wouldn't go for the repeat scans every 6 months. And I said, you know what? I can run my own blood work. I still do it to this day every 3 to 4 months because I know what to look for. And I said, if something goes wonky, I'll come back in and do the scans, but I certainly don't want to do it prophylactically so that, I'm back in your office and we're going through this again in a few more years
Exactly.
and never looked back. And that was really the end of the allopathic treatment on the cancer journey. And I still continue to run labs and supplement and eat right and, do all of those good things that can keep the terrain healthy, for the next, I'm going to live to be 112. So I got a few more years that I got to take care of myself.
Well, exactly. Now, how do you, I know you said it's all organic and it was all, like the beef was pasture, all that kind of stuff. But what do you do if you go out and eat?
It's a great question. The best I can, right? So, I definitely try to stay away from a lot of the chain restaurants because you just know the source of food is not going to be as high quality, right? Like I try to go to restaurants that are more family owned where at least they tell you that they're getting better sourced meats and you do the best you can. But at the same time, I do eat home a lot for that reason because I have a little bit more control over what I put in my mouth than at a restaurant where you really don't know.
Well, one of our doctors wrote a best-selling, Times book, and it was 6 things that you do to stay well, and number 2 was don't eat out. That was one of the main things that he said to do. And so I agree with you 100%. And you're on the road. I mean, so you have to deal with that. Now, in your daily diet, do you take a lot of vitamins now?
I would say medium amount. So after popping 150 pills again, if I never saw a capsule again, it was too soon, right? So it was really hard for me after to continue that type of regimen. So I've got a little magic trick. Most of my supplements, I actually dump into a smoothie in the morning. I make a drink with coconut water and I throw my protein in there and all of the supplements that I possibly can in a powder or liquid or open up the capsule form. And I drink my supplements now because it's so much easier to get down than swallowing a bunch of pills. But I still follow a regimen and I still recheck my labs all the time to tweak what I need and what I don't. Because I'm a big fan of also, if you don't need it, don't put it in.
Exactly. I mean, it's common sense. And so,
sometimes.
Yeah. Also, I understand that you have done some concussion work on athletes.
I have. So, it's funny how you fall into things, right? And how they become important to you. I have 3 kids, 2 boys, and both boys played tackle football. And in my community, unfortunately, they start too young, right? Because if they start young, then they get the spots when they're older. And it's just sort of the way of the world. So what happened is I was on the sidelines of a game and I was the team mom and the team photographer. And I've also sat on, I sit on the board. I don't anymore because the kids are older, but I sat on the board for the organization. And on the sidelines, I watched 2 boys, not my own, but of the team. I watched 2 boys go head to head, hit the front of their helmets, both back on their backs on the floor, on the field. And I immediately, turned into a chiropractor instead of the team mom. And I ran right out to the field. The boy from the opposite team, turns out he popped up, ran off to the side of the field. So I figured, okay, that team can be responsible for him. And I was tending to one of our athletes because there was no athletic trainer on the field for that game. And I looked at the opposing coach who ran out as well. And I said, please do not touch that child. He needs to be assessed not only for concussion, but for spinal injury. It is inappropriate to move that child till we know it's safe. And he started to yank on that child's arm and says, we have a football game to play. And I said, I don't think you heard me. Like, that is not a safe thing to do. I identified myself as a chiropractor. And I said, please don't touch him. He picked the child up in front of me and walked him off the sidelines.
Wow.
Now, after being completely livid and disgusted, I assessed the child. Thank God, no spinal injury. Turns out he was concussed. And we took good care of him and he wound up being absolutely fine. But as a result of that entire experience, concussion became really important to me. And I thought, we've got to do a better job educating people, not only on the signs and symptoms of concussion, but what to do when you're concussed. And because I have, a specialty in internal medicine and nutrition, I decided to take that work and couple it where now I love to run around the country and educate other people on pre and post concussion nutrition and how to help not only kids, but adults, and then therefore professional athletes, because a concussion is a concussion regardless of what age you are. And there's so many great things that we can do to help speed up that recovery so that we don't hear those terrible stories 20, 30 years later of people who are really suffering neurologically as a result of improper care. And it was that impetus that really got me interested.
Well, I'd like to know just roughly, what kind of vitamins and supplements and so forth do you use for a concussion?
Yeah. So sometimes, again, it depends on tests, but just some basic things that we look at is we look at omega fatty acids, which are really great. We look at boswellia, which helps to reduce the inflammation. We use a lot of magnesium threonate, which crosses the blood brain barrier. So it helps from that standpoint. We also have to pull out any sort of food that can be inflammatory. So no chemicals, no aspartame, food colorings, no caffeine, no alcohol, no sugar. That's also equally important, on top of some of the supplementation. Resveratrol is another great one to lower inflammation. There's some great studies on zinc. So we use a ton of zinc very carefully to make sure that we don't get the levels too high, but yet for that short term, we'll supplement that way. Sometimes we'll use some amino acids as well, especially if there's damage or we start to see some neurological changes where there's anxiety or depression. And the amino acids can really cause a better balance of the neurotransmitters. So we don't see some of the mood or behavior changes as a result. So there's a pretty good gamut of things we can pick from, depending, again, how severe, what the symptoms are that they're expressing, and then laboratory tests that we find.
You said no sugar, which brought me to think of something else because there's so much on lowering blood sugar today in the United States, sort of, pre-diabetes, part type 2 diabetes. Do you have a regime for type 2 diabetes for lowering blood glucose?
Yeah, so food wise, it is just that, right? And it's not just the sugar people think about, it's also some of the carbohydrates. So, if you live on baked potatoes, that carbohydrate's going to convert to a sugar in the body. So I always say it's white things, right? White sugar, white flours, white rice, et cetera. Anything that is typically white can also convert. Then we can start to do things like chromium picolinate. Berberine HCl is really good at lowering hemoglobin A1C levels. Strontium may play a role.
Tell me that
Oh,
again.
go ahead. I'm sorry.
The one that was so good in lowering AC1.
Oh, berberine.
Berberine.
Berberine, which is an herb, it comes from golden seal, berberine HCl. And it actually behaves very similar to the GLP-1s now that everybody's, clamoring towards that aren't necessarily so safe. So when we use a regimen of things like cinnamon and chromium with the berberine, we find that hemoglobin A1C, along with a good diet, can't get away without that, tends to lower that A1C level without the use of some of the drugs that people, seem to get stuck on out there. So in the world of functional medicine, it's great because I like to think I have an alternative for every pharmaceutical out there.
Well, that's a good thing. I mean,
It is a good thing.
Because if you're a practitioner, you run into all kinds of problems. And you're also into women's health. Tell me about that a little bit.
Oh, so, by default, right? I mean, most of the people that come into my practice are women. And let's face it, when the men come in, they're dragged in by the women in their lives most of the time. So, taking care of women mainly in a practice, you're going to come across things like fatigue, premenstrual syndrome, perimenopause issues, menopausal dysfunction. And, at some point you make the decision that you either have to take that on or you've got to find a practitioner that's really good at it to refer out. And I'm not a big fan of referring unless it's something I don't know. I love to take things on. So the women's health became really important. I also had an amazing mentor. I don't know if you remember Dr. Frank Strahl. He's been gone for quite a while now. But Frank taught obstetrics and gynecology at National University, which is where I graduated. And I was in his very first obstetrics and gynecology class. And I thought it was the strangest thing that here I am going to chiropractic school and I wanted to be a sports chiropractor, like about 80% of my class. And Frank's up there talking about like vaginal health and testicular health. And I'm like, what does this have to do with chiropractic? It doesn't make any sense to me. Well, it may not have a direct correlation, but at the same time, it comes back to whole body health. And what's really interesting is even if you think about it from a low back pain standpoint, how many patients walk into a practice with low back pain, unresolved, doesn't get better. And as it turns out, it's prostate cancer that's referring to the low back. So I started to gain an appreciation for pelvic health, both in men and women, and the relationship it has to low back pain, and realized this is actually really more important than I realized when I signed up for the program of chiropractic. And just really from that point on, with his leadership and his mentorship, fell in love with women's health, because I think there's so many of us out there that think what we go through is normal, and it's actually common and not normal. right? It's not okay to have cramps when you have a period, and it's not okay to have hot flashes when you're in menopause. And all of those different symptoms, I think, have become normalized and accepted in our society. And women don't know what to do about it. And I'd love to share that, there is something you can do about it, and it's absolutely fixable. And it's really fun to take that on and accomplish those things for the women that walk into the practice, because they go from miserable to really happy. And that's a great path.
What would you say? Do you have probably 70% women in your practice?
Maybe even a little higher, probably 70 to 80. And I mean, I treat kids, I treat elderly, but I see a lot of young women, 12, 13, 14, 15 years old that are also having trouble with their periods, all the way through, everybody who's in my club that's already menopausal and, wanting to find that youth again where, it's not painful to walk through the hormonal changes.
What do you think about the upcoming geriatric population?
Well, you know what? They're just as important as our young population, right? I think the shame of it is a lot of time as we get older, we get written off. And we even do that to ourselves, right? So there's people who will sit in my office and go, oh, well, it's just because I'm older. And I never let anybody use that as an excuse in my office. So as we age, things do change. There's no denying that, right? There's things that break down or things that are produced less of or more challenges. But I never let anybody use it as an excuse to accept the changes, right? So we can look at those things and implement something to help them, to change them, to improve them. So that really at the end of the day, I have this joke. I say, I want everybody to live to be 112, and one day you lay down and you don't wake up. That's how we're supposed to go.
Exactly.
Right?
Exactly.
How we're supposed to go. How we're supposed to go. And my number is 112, which is why I picked that. If yours is something else, that's okay, and we can work with it. But I want everybody to know that they really can feel good, whether they're 10 years old or 90 years old. Neither is an excuse to say, it's okay that I have symptoms and I feel lousy.
What's your greatest feedback and the most fun you have when you go lecturing?
Oh, it's fun. I love to stand on stage and know that somebody paid at least $5 to hear me speak. After having 3 kids and, you talk and you talk and you talk and you wonder if anybody's listening to you, it's really cool to stand up and be heard. I think what's really rewarding for me actually comes after that. And that's when somebody walks up to me afterward and says, you know what? I have exactly what you're talking about. Or I have a patient that has exactly what you're talking about. Can you help them? And then we do. And it's nice to know, because if they approach me that way, it gives me an indication they probably didn't know how to get help prior. And if that one presentation gives somebody that direction to accomplish something in a good way, then that's the high for me. And I just love it. I love to educate people and take the information and, go get everybody well.
Well, that's where you get your enthusiasm from. It's it
Yeah.
shows that that's where you're having fun. And
Yeah.
have you ever had stage fright?
I don't know. I mean, I still get a little nervous sometimes, which, I'm still trying to figure out who they are in that sentence. But, sometimes they say that even, the highest level speakers still kind of get butterflies and a little bit of nerves when they go out. It's almost like more of an anxiousness just to get there and do it, right? Versus sort of that stage fright. I mean, I probably had it the first time, and then I think I got over it pretty quick because I just love it.
I remember the day that I got over it. It was in Parker, and I walked across the stage, and it was like a full house. And I think I was 28 years old or something, and we had it at Madison Square Garden in New York, and there were 6,000 people there. It was Jim Parker's heyday. And I walked out there, and I all of a sudden realized I wasn't scared, and it was one of the best days of my life. But I had worked at it, and as you have worked at it. And so when you know your material, that's what gets rid of it. And so, public speaking is the number one fear of people. And so that's why you've overcome it, because you've got a good message and you're not afraid to tell it. And, you're out there, you're a pro.
Oh, well, thank you. And I never get on stage and talk about something I don't know about, so it's easy, right? When you know your stuff.
Well, it sounds like you've experienced most of it. And
I have.
I think that's the other thing that's important is you experience it. in Activator, we're looking at the geriatric population, probably because I'm a geriatric, but we're looking at that and we're coming up with some things to do when people have had a replaced knee or a replaced hip or, something like that. And in Activator, we don't hurt the patient so they can be treated quite easily. And so that's one of the things that I'm into, and that's why I ask you about geriatrics, what you thought about it, because half the population in the country will be over 65 by 2030. And so that's why we're majoring on it. So you have covered a lot of ground here, and I know you're busy. I appreciate you coming on, and I can't thank you enough for sharing. And, feel free to use this with your people too, because we want as many people to find, if they've got another problem, and like you had, and you found a solution and you were brave, and that was a great thing. So thank you very much, Cindy, for being on the program.
Oh, my absolute pleasure. Anything I can do to help you, just reach out. That's what I'm here for.
Thank you very much.